Pharmaceutical companies make a lot of money. I mean a lot of money. Estimates vary, but the global pharmaceutical industry is worth about £579 billion, and in 2016, it's predicted to be worth around $720 billion. But for every dollar they spend on basic research, $19 goes into promotion and marketing. It's more profitable for them to create products that are only slightly different from drugs they already have than put resources into finding groundbreaking new medication. What's worse is that some companies have actually stopped making life-saving medications because they don't offer the same financial rewards as, say, Viagra. Right now there's an Ebola crisis going on, and people are saying that a vaccine might have already been created if more money was involved. But there are other diseases in Africa which kill loads more people than Ebola. Again, they're not getting the research they need. Why? Because they're unprofitable. Once you actually develop a cure or a vaccine, pharmaceutical companies then file a patent for the drug and start a practice called evergreening, basically meaning that they can protect their drug for decades and stop other people making cheaper copies. India avoids patents and bans evergreening to try to keep medicine cheap enough that its people can afford to buy whatever it is that they need. But they're now coming under pressure from the US government and international drug companies who want India to allow evergreening. If this happens, this means cheap medicines will disappear, and people will be forced to buy expensive US imports which they can't afford, considering the average person lives on around £2 per day. Some companies are trying out new approaches. Roche, a Swiss company, has created new brands and packaging for lower priced drugs in India and Egypt. But what if people start buying drugs in low price countries and sell them at a profit in high priced ones? What then? Some are calling the pharmaceutical industry the new war on drugs. And like the illegal drug war, right now governments are calling for new policy reforms. It's a shame that we have to wait until Ebola hits the mainstream media headlines before pharmaceutical companies take notice. The death toll is well over 3,000 now. Would a vaccine already be available if it were more profitable? This is a messy subject. Pharmaceuticals are produced by private companies, but the drugs made are a public good. Like many others, it's an industry. But should profit come into it when human lives are at stake? Have your say? Click the links to find out how you can affect the future of this story.